Icona Health and Research Consult is pleased to welcome you. My name is Michael. We would love it if you can subscribe to our channel and also help us grow alongside. Today, I will walk you through rheumatoid arthritis. That is the diagnostic criteria for rheumatoid arthritis. Because the prognosis for this condition is usually very poor, early detection and treatment of the signs and symptoms is very beneficial. Knowing these parameters as a doctor and a physical therapist can assist you slow down the patient's impairment and also help you to improve upon the patient's daily activities of living. The majority of the people confuse it with osteoarthritis, and in this video, I will share the 7 diagnostic criteria. What is rheumatoid arthritis? Rheumatoid arthritis is an autoimmune and also a systemic illness that causes symmetrical involvement of the peripheral joints. To be very specific, the tiny joints of the cervical spine, the shoulder, the elbow, the wrist, the knee, and the feet. Symptoms could include pain and stiffness. Now let's move to the American College of Rheumatology. The American College of Rheumatology has established the 7 criteria for rheumatoid arthritis, and it specifies that if a patient meets at least 4 of the 7 criteria, the diagnosis should be confirmed, and that the first 4 has to be present at least for 6 weeks. Remember that rheumatoid factor testing is very crucial for both RA diagnosis and prognosis. This is according to Session et al. 2005. Now let's move on to talk about the 7 criteria for today. The first of the criteria is morning stiffness. So morning stiffness in and around the joints, which approximately lasts for 1 hour to have maximum improvement. Now, this is quite different from osteoarthritis. Osteoarthritis morning stiffness is basically less than 30 minutes and the patient is fine and the patient can move around and do his daily activities of living. So if you want to be able to determine if this is rheumatoid arthritis or osteoarthritis, then as a practitioner you need to ask questions how long the morning stiffness lasts. The next one I want to talk about is arthritis of 3 or more joints. So with rheumatoid arthritis, at least 3 joint areas simultaneously will have swelling or fluid accumulation. This could be observed by the physician or the physical therapist during assessment. The possible areas of rheumatoid arthritis are the right or left proximal interphalangeal joint, the metacarpophalangeal joint, the wrist, the elbow, the knee, the ankle, and the metatarsal joint. The third one I will talk about is arthritis of the hand. In rheumatoid arthritis, at least 1 area swelling in the wrist should be present. That is the MCP or the PIP joint. So the next thing I will talk about is symmetrical arthritis. So with rheumatoid arthritis, most of the symptoms are symmetrical. Symmetrical in the sense that if it affects the distal interphalangeal joint here, it should affect the other side of the hand, the same distal interphalangeal joint. If the condition affects the wrist joint here, or perhaps the left wrist joint, it should also affect the right wrist joint. And that is how rheumatoid arthritis presents. And it's quite different from osteoarthritis. Don't forget that the first four items, that is morning stiffness, osteoarthritis of 3 or more joints, arthritis of the hand, and symmetrical arthritis should be present for the first 6 weeks. The 5th one I'll talk about is rheumatoid nodules. This should be observed by the physician or the physical therapist, that is cutaneous nodules. These are formed over bony prominences or extensor surfaces. The 6th one I will talk about is serum rheumatoid factor. The physical therapist or the doctor can request for a lab test to check the percentage of rheumatoid factor that is in the blood stream. Positive result is an indication of rheumatoid arthritis. The last one is radiographical changes. As a physical therapist, you need to request an image or an X-ray which will show erosion or leaving no doubt of bony disc calcification, which is localized or marked adjacent the involved joint. Now, these are the 7 simple diagnostic criteria that every practitioner should know. This serves as a guide. Remember that the patient will benefit as we discover these symptoms early. And evidence-based practice will also improve the prognosis of our patient. This is Icona Health and Research Consult. Thanks for joining us, and don't forget to like, subscribe, and share. And also press the notification bell. Thanks for watching.